Okay, let's just try to picture this. Surgery before, say, the 1840s, the biggest challenge wasn't just doing the operation itself.
No, not at all. The real challenge was keeping the patient from dying from the trauma of it all.
Right, so surgeons had to be incredibly fast, not to show off their skills, but because if you took more than a few minutes.
The patient would likely die from the shock, from the sheer agony of it.
And we're talking about patients being physically tied down to the operating table, restrained.
Exactly. It was just unbelievably brutal, which is why most people would rather die at home than go to a hospital.
Did they try anything, like alcohol?
Sure, they'd give people alcohol,
Hmm.
but that doesn't really stop pain. It might make you sleepy, but you're still feeling everything.
So they were missing that key piece, a reliable chemical to just turn off consciousness.
That was the missing link. And the whole era of that unavoidable pain finally ended, kind of ironically, with something that started out as a party trick.
A party trick. Okay, so how do you get from that terror to a quiet, deep sleep?
Well, it starts with a gas that, believe it or not, made people laugh.
Laughing gas.
Exactly. Back in the late 1700s, a chemist named Humphry Davy discovered nitrous oxide.
And when people breathed it in.
They'd get relaxed, happy, euphoric, and sometimes they'd just burst into laughter. So yeah, it got the nickname laughing gas.
But this wasn't for medicine, you're saying?
Not at first. It was pure entertainment. People held these laughing gas parties to watch their friends act goofy.
So who made the connection?
Dentists. They were the ones who noticed that while it didn't totally erase the pain, it made patients so relaxed and happy they just didn't care as much about a tooth being pulled.
Which is a huge improvement over being tied down.
Massive improvement. But it wasn't a smooth transition into medicine. There was this one dentist, Horace Wells. He tried to do a big public demonstration.
How did it go?
It failed, publicly. He gave the patient the gas, the procedure started, and the patient still cried out in pain.
Oof. That must have set things back.
It seemed less a failure at the time, but the idea itself was solid. That a gas could change how we perceive pain.
And we still use it today, right, in dentistry?
We do. It's great for keeping patients calm. But it wasn't the breakthrough for major surgery. That came a little later, in 1846. And it wasn't a gas.
It was a liquid.
It was a liquid. This is a big turning point over in Boston. A dentist named William Morton started messing around with a chemical called ether.
I've heard of ether. It's like a solvent. Right?
Yeah, it was known for other things.
Yeah.
But he figured out how to have a patient inhale the vapor safely.
And this was the one that worked.
This was the one. He set up another public demonstration. The patient breathed in the ether from a glass globe and just fell into this deep, quiet sleep. No screaming, no struggling.
And the surgeon could just work.
The surgeon removed a tumor from the patient's neck, calmly. When the patient woke up, they asked him what he felt.
And he said,
"I felt no pain." That was it. That one sentence proved that agony in surgery wasn't a given. It was optional.
wow. The news must have just exploded after that.
Instantly. It spread all over the world. Ether became the first real, widely used general anesthetic.
But science never really stops at the first good answer.
A doctor in Scotland, James Simpson, he found an alternative: chloroform.
Okay, so why switch? If ether was working, what was better about chloroform?
A few practical things, actually. It worked much faster. It had a less unpleasant smell.
Sure.
And it was way easier to carry around.
Easier to carry.
You didn't need this big glass globe contraption.
Yeah.
Chloroform was just a liquid in a bottle.
That sounds great. But there was a catch, right? I remember hearing chloroform was more dangerous.
Much more dangerous. That's the trade-off. There's a razor-thin line between the dose that put you to sleep and the dose that stopped your heart.
How are they even measuring it?
By hand. They were literally dripping it onto a cloth held over the patient's face, counting the drops.
That's terrifying. They were just guessing.
It was basically guesswork based on experience. You had to be a master chemist and a surgeon at the same time to get it right. But despite that risk, it got incredibly popular.
Why? Just for the speed.
Speed and convenience.
Yeah.
Especially for childbirth.
So even with these breakthroughs, I'm guessing not everyone was on board immediately.
No, there was a lot of social resistance. Some people, especially from a religious standpoint, believed pain was just a natural part of life, that you shouldn't use chemicals to avoid it.
So what changed their minds?
It needed a major public endorsement, and it got one from literally the most famous person in the world at the time,
Who was that?
Queen Victoria.
Oh, wow. Okay.
In 1853, during the birth of one of her children, She specifically asked for chloroform to help with the pain.
And she talked about it publicly.
She did. She called it that blessed chloroform. And when the queen says it's okay, it basically removes all the social stigma overnight.
If it's good enough for royalty.
It's good enough for everyone. That was the moment that really bridged the gap between a scientific discovery and public trust.
So as anesthesia gets better, surgeries must have gotten more complicated.
Way more complicated. Surgeons could now take their time and do really detailed work inside the body. But that created a new problem.
What's that?
The surgeon can't be focused on a delicate internal repair and also be watching the patient's breathing and heart rate at the same time. It's too much for one person.
So you need another expert in the room.
Exactly. And that is how the specialty of anesthesiology was born.
So this person's only job is to manage the anesthesia.
Their only job is to be your personal life support system during the entire procedure. They plan the specific drug cocktail based on your weight, your health, your allergies.
And during the surgery, they're just watching monitors.
They are watching every single second. Your heart rate, your blood pressure, how much oxygen is in your blood. And if any of those numbers move even a little, they adjust the dose instantly.
It's not just about putting you to sleep then.
No, it's about keeping you perfectly stable while you're asleep and then making sure you wake up safely and with as little pain as possible. It takes years and years of training.
And this is all for what we call general anesthesia, right? Being completely unconscious.
Right. But not everything needs that.
Yeah.
For, getting a cavity filled or a deep cut stitched up, you'll probably get local anesthesia.
Which just numbs one specific spot.
Exactly. It's all about targeting. The first local anesthetics actually came from the leaves of the coca plant.
Huh. Interesting.
Yeah. And from that, we developed the much safer synthetic drugs we use today, like lidocaine.
And how does that work? It just blocks the nerves.
It literally blocks the electrical pain signals from traveling up the nerve to your brain. The signal never arrives, so your brain never registers the pain, even though you're wide awake.
And then it just wears off after a couple hours.
Wears off quickly, with very few side effects, which is perfect for minor procedures.
So fast forward to an operating room today. What's changed? The drugs must be incredibly advanced.
Oh, completely. We now use a combination of refined gases you breathe and very fast-acting IV drugs that go right into your blood.
And I assume they're much safer.
Much safer and much more precise. They're designed to be gentle on your heart and lungs, and they let the anesthesiologist control the depth of sleep with extreme accuracy.
Is that why so many surgeries are same day now?
It's exactly why. The drugs are cleared from your body so quickly that you can be awake, alert, and ready to go home just hours after a procedure.
But all of this relies on technology, too.
Absolutely. The modern operating room is filled with safety monitors, that little clip they put on your finger. The pulse oximeter,
Yeah, what does that do?
it's shooting light through your fingertip to measure, in real time, how much oxygen your blood is carrying. If that number dips, an alarm goes off immediately.
And there are monitors for everything else, too.
For your heart's electrical rhythm, for the amount of carbon dioxide you're breathing out, every vital sign is on a screen, letting the team react in a split second.
It's that combination of better drugs and better tech that makes it so safe.
Incredibly safe. But safety really starts before you even get to the OR. That's why those pre-op rules are so strict.
You mean like the don't eat or drink rule?
That's the big one.
Why is that one so critical?
It's about preventing something called aspiration. If you have food or liquid in your stomach and you vomit while you're unconscious and lying flat,
It can go into your lungs?
and that can be extremely dangerous, even fatal. So fasting just makes sure your stomach is empty and eliminates that risk.
Okay, so the surgery's over. What happens next? You go to the recovery room.
Right. And you'll probably feel pretty groggy, maybe a bit confused, a little chilly as the drugs wear off.
And the nurses are just there watching you?
They're there keeping you warm, monitoring you closely until you're fully awake and oriented. You might have a dry throat or feel a little nauseous, but that's pretty common.
How long until you feel normal again?
For most people, within an hour or two, they're feeling much more like themselves and are ready to head home.
And the story doesn't end there, does it? Where is the science heading now?
The big push now is towards personalized medicine.
What does that mean for anesthesia?
Well, they're looking at genetics, studying how your specific DNA affects how you react to painkillers or how fast your body processes these drugs.
So a custom plan for every single person.
That's the ultimate goal, a bespoke anesthetic plan based on your own genetic makeup. Plus, they're working on new, powerful, non-addictive drugs for pain management at home.
To make recovery even faster and easier.
Exactly. The whole goal is to eliminate side effects and shorten that recovery time.
When you look back, it's just an incredible journey. From, surgeons racing against the clock while patients screamed.
To today's safe, quiet, and precise procedures. It's one of the best stories of scientific progress, all driven by a really basic human desire.
Just the desire to heal without having to endure that kind of pain. Anesthesia doesn't just give us silent surgery, it gives the surgeon time.
Time to be careful, to be precise, and to save lives.
Good luck with your studies.